Guilford County is moving forward in its corrective action plan. What we have noticed in this past review is that we are really looking at an increase in a demonstration of practice in regards to safety and also planning. And I'm extremely pleased to see that.
Our continuous quality improvement training team has been working really hard to align all of our training policies with the state policy. And so we've been creating trainings for the top down. So we started with program managers, and then we provided a training geared specifically towards supervisors, and then lastly to workers. At this point, we are reviewing safety assessments to ensure that they're doing the job properly.
We are committed to digging deep and enhancing our practices, not just as part of implementation of the corrective action plan, but really for long-term, sustainable change in the way we practice and serve our community.
The deep dive that we have done in promoting continuous quality improvement requires an investment in staff. And so in December, we were able to receive support from the board to increase our child welfare service staffing model with an addition of 27 positions. Those positions represent continuous quality improvement, an increase in child protective services staff, but also an increase in our in-home service delivery line. And so I look forward to how we will continue to support families and advance the work. I think the investment that was made demonstrates the county's commitment to service excellence.
Part of the corrective action plan was to address our backlog and the number of cases that we've had open in assessments. We ended up developing a backlog team. We pulled specific social workers, a specific supervisor, and a program manager to get together and work towards those cases. Those cases, every single morning, there's a brief staffing with the entire team. We are taking cases that are our oldest cases and our highest risk cases. So we are combing through cases, asking for referrals, and then letting workers know, hey, this case is going to come to the backlog team, and the backlog team will then handle it and ensure that there's a safe closure and that everyone is safe before we can close that case. So in doing that, we've been very successful in closing cases. We've reduced our backlog by 68%.
I am extremely pleased with the pace and the intentionality in regards to decreasing our backlog. That's going to move us in a different way in regards to the number of cases that social workers are assigned, and it's going to really create an opportunity for us to apply all of the learning and the coaching that we have received for our active cases in the months and also the years to come. I truly think that we are pivoted in the right direction to really promote, again, our county value of service excellence and really lean into sound and high quality child welfare practice.
Currently, Guilford County DSS is working diligently with the court partners to increase our numbers of reunification. And for those children that cannot return to their homes safely, we're working to expediently move them through the adoption process for a forever home. Since January 2024, Guilford County has found permanency for 19 children through reunification, through guardianship, and through adoptions.
We are really excited to begin partnering with Allies for Outcomes. In March of 2024, we started working with them to really help retain a quality workforce, to achieve better outcomes, and to strengthen our social work practice.
We're going to continue to take a deeper dive with our court partners around permanency and making sure that our children that are in foster care can move towards permanency within a timely manner. We're going to continue to see an increased utilization of relatives as well as kin as it relates to safety resources, also placement options, and also for plans for permanency as needed. And so I'm excited to see how that continues to shape up.
Going forward, you can expect more of the digging deep, looking at all of our practices, looking at how it enhances the work we do in the community, and making sure that we're keeping the protection of children and the safety and security of families at the forefront.